Hello, everyone, and welcome to a general CareRight presentation. As we'll see from the first couple of slides here, CareRight can be deployed in a number of different configurations for different market segments. Today, I really just wanted to focus on the core product CareRight, and although it can be used in inpatient hospital settings, today I'm going to focus mainly on the outpatient clinical settings. But if you did have any questions around inpatient configurations, please reach out. Okay, so introducing CareRight. Well, the company is Clintel Systems, and our core and our flagship product is CareRight, which has been around for nearly 10 years now. So Clintel Systems itself was established back in 2006, and we provide clinical and medical software management and expertise to Australian-based healthcare providers. We do have some international deployments as well, but our key focus is in Australia and New Zealand. Our clients do vary, so we have both public and private customers, and they can range anywhere from medical specialists, day hospitals, hospital chains, and obviously public health departments and organisations. We are based in South Australia, but we do have employees around Australia. Focusing on CareRight now. So you can think of CareRight as a toolkit because it's very configurable. So usually we just need to collect your requirements and we can configure up a bespoke CareRight instance to suit those needs. If you're not looking for something so tailored and I guess complex, we do have out-of-the-box solutions for each of our different applications, which we'll talk about a little bit later. But in essence, CareRight allows you to optimize your workflows and increase productivity and scale. CareRight's typically deployed as a fully integrated end-to-end digital health system. Now, what I mean by that is, I'll take one of our clients, for instance. They're a mental health hospital down in Tasmania. They have inpatient settings or functions. They have outpatient functions. They have day programs, and then they have a variety of other services. So instead of having one software application for each of those, I guess, activities, CareRight can be configured as an end-to-end solution, one software application with the option to integrate different accessory softwares and functions, one system to replace 3 or 4 systems to provide one end-to-end solution for the organization. Currently, CareRight supports hundreds of thousands of patients, thousands of users, and we've been in operation for about 15 years. Down the right-hand side here, you can see typically the segments that we address or provide solutions for. These combine hospital, community outreach or hospital in the home, day hospital, clinical case management, outpatient settings, university or academic institutions. And then again, when I say end-to-end solutions, that's all of that combined, or pick and choose what you want combined into delivering one fully integrated system. Talking about the core functionality of CareRight, the core modules encompass a patient administration system, electronic medical record, and billing and claiming. And then there's a whole raft of specialty modules and supporting services, functions, capabilities, and existing integrations, which you can pick and choose from to be part of your application or not. This slide is probably already outdated. We're very progressive when it comes to our development schedule, but I thought I'd show up here the common functions and capabilities and services. These are split between PAS, EMR, business utilities, and claiming. A few I'd note there, some ones that we're very proud of getting up and running would be our telehealth integration. We integrate CoverU. We also have My Health Record integration, online bookings. Now, the online bookings is a CareRight module. It's not an external integration. So CareRight online bookings works seamlessly within your CareRight development or your CareRight deployment. We have all of your billing and claiming needs covered, ranging from Medicare Online, Eclipse, Allied Health, DVA, work cover, etc. And electronic medication management is our next big release, which is set to be on board within the next month. So once you've produced your or you've picked and choose the different components of your CareRight core product, and then you've sprinkled on top all of those accessory functions, modules that and services that you want to make use of, over the top of that is a very powerful workflow layer. So different parts of your business that you'd like to be more streamlined or automated, CareRight can be configured to deliver upon those. Some examples might be billing automation if you have complex billing, maybe patient intake, any part of the business which you'd like to be maybe reduce the amount of users you have taking care of that. Or we've helped one customer recently, I think they had about 30 or 40 people involved in billing. We were able to streamline that billing and better use those resources in different areas of the business. There's obviously electronic care pathways, which would also be another great example of CareRight workflow. What I mean by that is maybe post-care, post-admission, post-therapy, you want to schedule 24 to 48 months of follow-up care with your patients. Again, that can all be configured and automated within CareRight. I thought I'd quickly show this screen. We have a very broad integration capability using HL7 and Fire, and for bespoke integrations, JSON REST APIs. And this image also shows things that we already have integrated into the product. So, like I said, we'd like to call ourselves a fully integrated end-to-end solution. And examples of that might be 3M for all of your grouping needs, use stat reporting, secure messaging, MIMS, the list goes on. Okay, I'm now going to flick over to the CareRight instance and we'll start walking our way through CareRight. Remember today, I'm really just going to focus on that very simple outpatient configuration. And you know, if you need to know more information about accessory modules or features, I'd be happy to walk you through that one-on-one. So I'm logged in at the moment as a doctor, Dr. Chris. And as Dr. Chris, as soon as I log in, I have my dashboard configured so I can see all of my appointments that I have today in time order. We also have the concept in CareRight of tasks. So any tasks that have been sent to me personally or to groups that I'm in will also be visible on my dashboard. Another concept, CareRight concept that really needs integration is CareRight Smart Forms, aka assessments, aka online forms. Within CareRight, you can generate any online form that you wish. If you don't need any special IT skills to do them. It's just a little bit of training on our behalf. However, if you prefer us to build your online forms for you, we're more than happy to do that too at a normal rate. Now, online forms allow you to standardize and streamline the capture of information in any part of your business processes. A location-based online form could be an incident report. So if you just want to standardize the way you collect incident report data, you can do that. And the great news about smart forms or online forms is they are 100% reportable. Another use of smart forms, I've seen them used as consult notes, as med charts, as observation charts. I've seen them used as online forms to send out to patients for them to complete before or after their engagement with the organisation. A mental health example might be a PHQ-9 or a DAS-21. You can actually automate and CareRight for those types of mental health assessments to be sent out at any time intervals you wish. And the data that's collected by the patients can then be graphed in the measurements tab, which I'll show you a little bit later. Obviously, a surgical example could be, hey, you came in for a procedure 2 weeks ago, please rate your pain or discomfort scale. The patient can complete that online, and then we can kick off workflow too. So if the patient answered maybe yes to questions 2, 3, and 9, for example, and that indicates the patient is in discomfort or pain, that can kick off a workflow for someone to reach out to the patient to kick off some type of engagement. I'm just going to continue to familiarize you now with CareRight. I'm at the global dashboard. So all the options on the left-hand side here relate to the global company. And what I mean by that is if you had more than one locations, this is a summary of all of your locations. The next dashboard would be your location dashboard. So to access that, you can click location. My demo environment's quite vanilla, but you could imagine if you had 5 locations that all be listed here. And if you click on a particular location, now all the options down the left-hand side relate solely to that location. The third dashboard would be the provider dashboard. So if I go into Dr. Chris here I can see all of my preferred information, my details, my certifications, stat reporting, calendar preferences, secure messaging, accounting, and also prescribing. So we've added this very recently for you to very easily be able to configure your e-scripting on a doctor-to-doctor basis. Also on the left-hand side, once you're in the provider screen, you can see all of those quick go-to items that a provider would probably want to access at any point in time. The fourth dashboard would be the patient dashboard. Now, the great thing about CareRight being a web-based system is all the patient names are little web links. So if I wanted to get into Beth's calendar here, either I could directly click on it, or if I didn't want to lose my place on my dashboard, I could just right-click and open up another instance. And now you can see I've gone into Beth's dashboard here, but I haven't lost my place back on my normal dashboard. So this is the patient dashboard. This banner is quite configurable. It's also color coded. At the moment, there's no alerts or allergies noted towards Beth, so she has a calming blue banner. If she did have an alert or an allergy, that could turn her banner red. And then we can also put these tiles in the banner to indicate anything that anyone needs to immediately note when dealing with Beth. They can be non-medical, for instance, a notice, which these two are, but they can also be alerts and allergies. An example might be, allergic to penicillin or on a blood thinner, or patient is an asthmatic, or patient can be aggressive, or something like that. Now that we're in Beth's profile, all these options on the left-hand side now relate solely to Beth. Going to go back to the global dashboard. I just want to point out to you, we have a nice help guide so you can search up anything you need help with at any time. And if you need to search a patient, this is your little search box here. So I want to search Beth. Anyone with Beth in their name comes up, and I can select the right Beth for me. And now I'm in Beth's calendar, Beth's profile, I should say. Now I'm going to orientate you with the calendar. Either you can access this through the patient dashboard. So you can see I'm back in Beth's profile here. If I click on appointments, here I can see all of the currently booked in appointments for Beth, all of her past appointments. You can see I use her quite a bit for demo. She has quite a few here. I can assign her to the wait list for an up and coming appointment, or I can search a new appointment for her. So I'll search for Chris, and maybe it's just a standard consultation. Hit search, and now all the date and time options will come up. And having Beth on the phone, I could say, what about Tuesday at 9 a.m.? What about Wednesday at 3 p.m.? Unfortunately, I haven't configured this. I haven't put any time in Chris' calendar, so it's coming up with no options found. But I think you get the gist of that one. Another way of accessing the appointment calendar would be directly from the global dashboard. So you'll note I'm now not in a patient's account. I'm back in the global dashboard. If I click on appointments, here I can look at anyone's appointment calendar. We can build for you any type of appointment calendar. It could be for a team, could be for a doctor, could be for an allied health person, it could be for a room, a theatre, or it could be for a group of entities. You'll see here, if I click on all providers, we've configured this in CareRight to bring up everyone that's working on this particular day. So Chris has a online booking schedule for today. Gordon is doing general consultations, and Stefan is doing procedures in Theatre 2 today. If I wanted to look at someone in particular, I'll just click on Chris, and now I'm just looking at Chris. Now, there's great functionality when it comes to the appointment calendar. For instance, I can drag and drop around wherever I like. Maybe Andrew has caught up and said, I've broken my leg, I'm now in a wheelchair. That's okay. I'm just going to put in here, in a wheelchair. and that note will be visible. Maybe Andrew now can't make it, so I'm just going to right click and I'm going to move him to the wait list. I can give a priority and a preferred booking message, and now he's moved to the wait list. Let's just say that Andrew calls and says, actually, I can make it in the afternoon. Now I can populate my wait list and I can drag and drop Andrew back in at 1 p.m. when he said he could make it in. Obviously, you can search for any particular, retrospectively or in the future. Your online bookings, your requested appointments will come through here. And also I refer to this one as the admin calendar. If I want to convert this over to a clinical calendar, I'm just going to hit list. And now it's almost like a theatre panel. I can see and I can do any searches that I want, but keeping it open, I can see what time something's happening, what the consultation is, who the doctor is. I can transition the patient through the clinic. And these are all user definable too. So if these don't make sense for you, we can put in ones that do make sense. Associated to each appointment, we can associate a unique form. So let's just say Chris Hemsworth likes to go through 10 different things as part of a telehealth consultation. So we would build that as an online form and we would associate this with this appointment type. But in contrast, Stefan wants to ask 5 different questions as part of a general surgery. So we would build that in a form and attach it to that particular appointment type. Let me click on one now just to show you. I'm just going to click form. And now this is an operation report that Stefan wants to use. The form, it's a smart form. It's that clever. It's going to populate the information we already have on the patient. And now I can go through and I can enter in any information that I want to do. Here's the operation details. And we've also configured this particular operation report to generate into a letter. So a high degree of configurability possible with the smart forms. And in contrast for, I'm just going to go down here to consultation review, click on that form. And as you can see, it's completely different. So don't get bogged down on the detail because really the form can be whatever you want it to be. I might just show you a little bit about the online bookings now. So like I said before, it's just a module of CareRight. Your patients could access online CareRight online bookings either as an embedded link on your website, or maybe you've sent them out a specific link inviting them to book in. Regardless, once the patient's here, and this is configurable too, maybe you want them only to book in a certain location with a certain doctor on a certain day. We can configure the URL that you send out to them to be quite specific with that, but keeping it quite open, the patient can choose the location, choose the appointment type, choose the week, and also choose a doctor. I'm just going to choose Chris on the 23rd of October. I'm going to select 3 p.m. Now, CareRight online bookings allows a patient to either online register. Obviously, if a patient online registers, that's going to free up so much time of your admin team, or they can choose that they're an existing patient. But for today, I'm just going to register a new patient. Maybe he'll be called Simon Gates. He's a male. You can see the mandatory fields here. I'm just going to put in some basic info at admin.com. Okay, I skipped ahead there. Let's see if I can go back. Yeah, good, I can. So attached to an online booking, either a patient registration or I'm an existing patient, we can also embed a specific smart form that you want the patients to work through as part of this online booking event. It could be a self-registration form, it could be a COVID screening form, it could be what's your current medications, who's your next of kin, anything you want. What's your billing information? You know, here we've got some billing information. So you can get those patients to complete that form at the point of online booking, again, freeing up so much time for your admin team. The next step should be, and because I hit back there, maybe it's going to time out here. Let me just quickly go through that again. Here we go. So Chris Hemsworth, book in, and I'll just think of a new name. So Simon Elizabeth. Okay, male, date of birth, admin at admin.com. Great. All right. As a patient, I can complete this form. I'm now going to hit proceed. And now I get this invitation to pay a deposit. You can choose whether you want to have this. We facilitate this through our Stripe integration. It's up to you whether you want to use this or not. I'm just going to put in some dummy credit card details here. Here we go, 1, 2, 3, pay now. And that's an online booking and registration complete. If I go back to my clinical CareRight and I search for Simon Elizabeth, there he is. If I hit show, he's self-registered, so he's built himself his own profile. He's paid his deposit, so that deposit will be sitting here in invoices and credits. The smart form that he completed would be sitting in assessments, and all of the information he gave us, such as billing information, current medications, would all be filed away nicely within his profile. And then his online booking will also be in the appointments tab, ready for someone to pick that up and run with it. So that's online bookings. I'm now going to show you some functionality with our patient engagement module. This allows us to share information with the patient for online completion. Please keep in the back of your mind when I show you this, that all of this can be fully automated. An example might be, let's say a patient books in for a certain appointment type. We can configure in CareRight for assessment A, B, C, and D to be sent out at different time intervals to the patient. For online completion, a whole raft of different SMS and email reminders just to make sure the patient confirms that appointment. And we can collect all that really important information either before the admission or the outpatient consultation. I'm just going to go back to my preferred demo patient here called Beth. Let me show you a couple of these online engagement tools. So being in Beth's profile, I'm just going to go to assessments, and the first one I want to share with her has health in the name. By typing in health, I'm searching my full SmartForm library for the word health. This is the one I want to send to her. Now, just as a side note, if I wanted to complete this form in clinic, I would merely hit perform, and that's me as a clinical user completing it. But if I want to send it out to the patient for online completion, I'm going to queue that one as a current assessment. I can choose whether I want to send that to the patient via email, SMS, or QR code. Let's just do email today. Okay. Now going into my, this is my little demo test email. I'm now pretending I'm the patient at home, and I've just received this new form from the clinic, the Clintel Centre. I can click on that one. And obviously this email can look lovely with all of your branding and coloring, but in its most basic format, it's a secure link for the patient to click into and to complete this online form. Remember too, these forms can kick off workflow. So let's just say we had a couple of questions here saying, are you diabetic? Are you hypertensive? Are you overweight? Obviously, if the answer to those 3 questions is yes, that would put the patient in a high risk factor for obstructive sleep apnea, just as an example. So we may choose to kick off a workflow to investigate obstructive sleep apnea with that patient, either referring out or sending that patient an invitation for a sleep study or a sleep assessment. Just going to submit that one for approval. Remember, we can automate all of this as well. I have mentioned that. Another great example might be video. So in this particular one, this one's a video post. Well, pre-op, we could send out and it could be, if it's not an admission, it could be pre-engagement. We could send out a lovely video of, hey, welcome to our clinic. This is what you can expect. These are our lovely doctors. This is our lovely admin team. And this is where you can park. In this particular example, I'm going to queue up video post-op, send that one out to the patient via email. Here it is. So you see if I click into this one, it's a video about, hey, you've recently seen us for an embryo transfer. You may be experiencing this. You should expect this. These are the do's and the don'ts. And I mean, this can be quite an intricate form, but I wanted to show you a very basic question. Are you experiencing any pain and discomfort? If the patient answers yes to that one, submits that one for approval, a new task would be now received in tasks in your clinical CareRight, notifying either a user or a group that Beth is experiencing discomfort. We need to get her back into clinic to investigate. Another example I might show you, and this is actually mental health specific, but you could understand this could be used over all specialties. just wanted to show you how I could send to the patient a mental health assessment. I'll cue that one up. Oh, I didn't send it. Here we go. All right, let me try that one again. Assessments. Let me try the DAS 21. Okay, send that one out via email. So patient receives the DAS-21, which is a mental health questionnaire. Patient puts in the date and the time. Patient starts going through and answering all of these questions. You can see I've only answered 4 here, but the smart form is already tabulating the depression score. This could kick off workflow too. I'll try and make it quite severe. If the output of this questionnaire is a high severity or any criteria really, we can kick off a workflow that patient is struggling and we need to do something. Very, very similar to the other example that I showed you. So if I just keep going down, you can see we've got a stress score of 19, anxiety score of 18, depression score of 20. These are the interpretations, and we could configure this form to kick off workflow. If I hit submit for approval, just imagine at the moment if we had automated this so that every let's say 30 days the patient's been sent out one of these for online completion, we can have all of this information collecting in the background. So when we go to the measurement section of the patient record, and if we go to DAS-21, we can see every single date and time the patient's completed it, what the score was, and then we can see that data scored across the screen as well. I'm always putting in random info so that graph doesn't look good. Maybe I'll show you the one for PHQ-9, which might look a little bit more impressive. Yeah, there we go. So now we can see that patient's trending data. Remember, you've automated the collection of this data. It's all happening behind the scenes, but whenever you want to check in on the patient, you can simply come into their measurements tab and check how they're doing. Now I want to run you through a basic consultation. The way you could do this a number of ways within CareRight, but I want to show you one particular way, a nice streamlined way of doing it. First of all, I'm going to book a patient in, and I'll use my lovely demo patient, Beth. Here she is. And today I want to do a standard appointment with her. There we go. I've booked her in. So now as the clinician, if I go to list view, and I'm now pretending I'm Gordon, so I'm just going to search Gordon's calendar for today. Here's the appointment I just booked in. So standard appointment. I'm Dr. Gordon Jones. Now I'm putting myself in the shoes of Dr. Gordon. I've just arrived in my clinical room. I'm ready to see the patient. I need to refamiliarize myself with the patient's record. So I'm going to right click, hop into the patient's record. I can go into previous clinical notes and refamiliarize myself with her clinical notes. I can hop into medications, refamiliarize myself with her medications. I can get into diagnosis and history, review her diagnoses, any alerts or allergies, any pathology, radiology, anything else that you needed to review as part of this engagement with the patient. I'm now ready to see Beth, so I can mark that one as ready to consult. And now without leaving this page, because I don't want to, this is my dashboard for the day. I don't want to navigate away from here. So for a really nice streamlined consultation, I'm just going to click form. And I've already built this form as everything I want to run through as part of a consultation regular appointment type. So here I can, don't get bogged down the detail here because this is just one of, we've mocked up here, but you can see the different things that we can collect. There's drop down boxes to make things nice and streamlined. There's free text boxes too. Here's all of her recent alerts. A lot of these have ended, but I could add a new alert here if I wanted to. Here's her allergies, Clinical notes, I might just put in some info here. Clinical note. Here's a diagnosis. I can add a new one if I like. I can add problems. I can add notices. I can add in follow-up information, and I can even start putting in my billing item numbers too. I'm just going to put in some random ones here and hit approve. So I've made that look really quick and really streamlined, but just going back to the usage case, I'm Dr. Gordon. I took Bethany into my room. I run through the consultation form with her. Once I was finished with that form, if I now go into her record, all of those bits of information that I collected from Beth would be saved and her record would be updated. For instance, that assessment that I just completed for her is here. It's been done and it's been saved to the clinical record. The billing item numbers, if I go to events, here's those billing item numbers that I collected for her. Actually, I've collected quite a few over a number of days, but it just shows you how you can take ongoing billing information detail from the patient. And when you're ready to streamline bill or claim it all, you just go select all and click invoice, and it brings everything together. You can send it off on one easy claim, or send one or pay one consolidated invoice. If we had taken vitals information, the measurements tab would be updated. Any clinical notes that we took would be updated here in this panel. If we had added any medications or written any pathology or radiology requests, that would be updated also. So what we've done so far is we've interacted with the patient on engagement. We received a referral, they booked in online. We also coordinated engagement with them. We sent them through paperwork to complete. It could be a different form to sign. We have the ability for online signature. We've collected the key information and also vital information from the patient. We've then had them either in clinic or via telehealth. We've run through a full consultation with them, including captured that billing information. We've streamlined the billing. Now the only thing to do is to schedule follow-up information, and that's really up to you. You show us your requirements around patient follow-up, how often, how you want to engage with them, what information you want to collect. Do you want to send them an invitation to rebook? And we can configure all of that within CareRight. In closing, I might just show you, if you go to locations and you go to the particular location you're at, all your invoices and claims are tabulated here, and these are hyperlinks too, so it's very easy to, for instance, let's go to iTest and look at unsent 10. Here I can see all of the unsent claims and I can rectify those. I can see all the incoming pathology and radiology for the clinic. Stat reportings if you're a hospital, reconciliation, the tasks for the location, all the billing events that have been collected for the day. If I click on that, here you can see we've seen a number of patients. We have a number of billing events for them. It's just ready for an admin person to pick these up and process them. If you're a hospital, here's your pre-admissions. Here's all of your follow-ups, all of your incoming and outgoing correspondence, all of your cases and programs information. We have a very robust reporting functionality within CareRight. The assessments that I've shown you today, or AKA smart forms, are all 100% reportable. So maybe I'll just show you that. If I go into reports, new report, assessment-based report, that health questionnaire, remember I sent out Beth a health assessment? Let's use that one. So now the system's saying, these are all the questions, or these are all the fields that you have in that health questionnaire. Do you want to include all of these or exclude any of them in your report? You can then add in any filters. Maybe I just want to do a filter by location or by patient or by date range. I can then choose the export of the report that I want to run, and then I can just hit run. Very, very easy to collect or standardize the collection of information and then report on it either retrospectively or into the future. Well, in the idea of keeping this relatively short today, that's a really good summary of our outpatient CareRight configuration. Look, there's a lot more things I could have shown you, so I would invite any questions you do have as a result of these. We have lots of other functions, services, modules, which I haven't even touched on today, but they would probably be the core functionalities. Thank you very much for your time, and I look forward to hearing from you.